Hey everyone, thank you for joining us and happy Friday. Hopefully no more surprises today, but we're actually going to meet Dr. Finan. He is our newest member to our medical team and is going to do wonderful things with our cancer program. But first, we're going to kick it to Lee for the stats today.
So Sarah, today we have a couple more positives. They're all outpatient, but what I'm going to do is I'm going to start, I'm not sending out a daily update. We're going to update once a week. It's a little more meaningful looking at a whole week's worth of data now that we've got the onesie twosies. So we're going to look at it more on a weekly basis. I will say, Dr. Finan and I were talking earlier, really a more important stat for how we're doing is the number of hospitalizations. And we're down to just 4 people that are hospitalized. Most of these cases lately have been outpatient, and so I think as a moniker of how we're doing compared to the rest of the country and the rest of even our state is really, really good. As things open up, there will be more positives. We're going to keep preaching because it is very easy to get this if you don't wash your hands, if you hug somebody, or if you touch your face after touching something someone else touched that has it. So we need people to stay strong in that regard. But anyway, today we are very excited to talk to Dr. Finan. He's a gynecologic oncologist, and we are just, it's exciting to us to have someone with that part of the spectrum of care on our team. So why don't you tell us a little bit about what you do?
Sure. Very happy to be here at Singing River. A gynecologic oncologist, it's a hard term to say, but we specialize in women's cancer essentially from the waist down. It's a subspecialty of OBGYN. So we do 4 years of medical school, 4 years of obstetrics and gynecology training, which I did at University of South Florida in Tampa. And then we do an additional 3 years of training in gynecologic oncology. And that is basically the comprehensive care of women with cancer. Primarily cancers of the ovary, the uterus, the cervix, the vagina, the vulva, everything below, all of the female reproductive organs below the waist.
And it happens a lot. People get cancer every day.
Right.
And to know that we've got someone of your caliber that can take care of those women right here in our community, it's a big, big blessing to us.
Oh,
Exactly. And amidst all this, you need to make sure that you are going to get your screenings, your mammograms
Right.
and your pap smears, because these kind of cancers, they can go undetected pretty quickly.
Right, and that's a good point. With COVID, a lot of women have put off their health care. Gynecologists were not seeing routine screenings. They weren't seeing annual patients who need an annual visit. So it's very important to get in for your pap smear. And I'll also put in a little plug for Hpv Vaccine. That's a way to prevent cervical cancer. If we could get everyone between the ages of 9 and 26 to get the Hpv vaccine, it's a cancer that we could really eliminate.
That's amazing.
So tell us a little bit about the spectrum of services that we have here. You work not just in your current capacity, but also a medical directorship type situation where you look at our other areas that we have. And tell us a little bit about, since you've been here, what you've seen on the whole spectrum of cancer care at Singing River Health System.
Well, first of all, I've been very impressed with the technology and the people here and all the expertise we have. I've only been here 2 months, but I've been blown away by everything. But cancer, you have to look at cancer, and your word was spectrum, and it is a spectrum. It starts out with screening and prevention. Prevention, cancer control. We can prevent many cancers. In fact, the American Cancer Society says that about 70% of all cancers are preventable. With, think about it, lung cancer, just quit smoking or don't smoke. Melanoma, don't use a tanning bed when you're a teenager. Don't get sunburned. Use a lot of sunscreen.
Right.
Hpv vaccine, which I just talked about, to prevent cervical cancer. It also helps prevent some head and neck cancers. So you've got the prevention, then you've got the screening. And the screening, we all know, is mammograms for breast cancer, colonoscopy or the Cologuard for colon.
PSA for men?
PSA for men, yeah, the pap smears, and then a skin exam for melanoma. And then now we have, relatively new, is lung cancer screening.
Right.
And lung cancer screening is extremely effective. We can pick up these cancers in stage 1, where they're surgically treatable and curable. we're talking about curing lung cancer if it's caught early enough.
Early detection is key. It's not like
Right.
it was cancers people would die of just 10, 15 years ago. Now today with
Right.
early detection, we can save somebody's life if they get a
Right,
screening.
right. And then the spectrum moves all the way through the diagnostics, which are done by surgeons, and we have an outstanding group of surgeons here. Surgeons who do breast cancer surgery and surgery on abdominal cancers.
Interventional radiology.
Interventional radiology. They can approach an organ anywhere in the body and get biopsies and put tubes and catheters in. We have interventional GI docs, gastroenterologists who are doing diagnostics with colonoscopy, upper GIs. We have a whole group of people who are in the diagnostic arena. And then you have the treatment, and the treatment is what I'm involved in, which is either surgery, and my specialty is also unique in that we're the only surgeons who also give chemotherapy. So you have the surgery, the chemotherapy, and radiation therapy, and now we have a whole new group of treatments called targeted therapy, which is essentially personalized medicine. We look at the molecular targets, and we target the therapy directly to those molecular targets. And then moving on, after treatment, most patients actually go into survivorship. The vast majority of patients go into survivorship, which is long-term follow-up. And then, of course, we also have hospice. We have our own hospice agency for those who need hospice, and palliative care as well. So the whole, I'm looking at the whole cancer spectrum and trying to improve the level of care across the board.
So a person can come see you in clinic. You can handle their entire spectrum of cancer care, including surgery. You do surgery on the Da Vinci Xi robotic assisted
Yes.
system as well.
And that has revolutionized what we do. And a neat thing about that is, and again, relatively new, and I participated in the original study that proved the benefit of this. It's called Sentinel lymph node mapping. And what we do is we inject some what's called ICG green dyes, in contrast, directly into the patient's, this is after they're asleep, directly into the organ. And that dye travels to the lymph nodes that are of importance, and those are called sentinel lymph nodes. This has been done for decades for breast cancer and for melanoma, but it's very, very new in GYN cancers. And the lymph nodes with the Da Vinci, you can flip to like a night vision, and the lymph nodes light up like a Christmas light bulb. They're like a bright green. It's unbelievable.
And that combined with the ability to, what you can do, the pinpoint precision with that robotic
Oh
surgery.
yes, it is amazing. And it turns a two-armed surgeon into a four-armed surgeon,
Right.
which is
It's
absolutely, it's unbelievable.
Incredible.
We wouldn't want that.
So I want to get to one more thing. I know we could talk all day, but one more thing I want to talk about is I've seen you participate in our tumor boards. Tell us a little bit about how that works, because I go into that and I see a pathologist, a radiologist, a radiation oncologist, a medical oncologist, general surgeon, thoracic surgeon, all of these
Pulmonary
people,
docs, yeah.
pulmonary docs, all coming together, case by case, to review these at 6:30 in the morning. Tell us a little bit about your perspective on the tumor board and how it
Right.
works.
It is amazing here. The participation and the engagement of the specialists is something I've rarely seen. In fact, we have a candidate who we're recruiting to join us, and she's a fellow up in the Northeast in a fellowship program. So she's in an academic center,
Right.
and she dialed in one morning by Zoom so she could participate by video. She was blown away. We had 12 cases that morning,
Right.
and she said they're lucky to have 2 or 3 cases that they can present. And the engagement amongst all the different specialists, the thoracic surgeons, and they're also doing robotic surgery, by the way,
Right.
in the chest.
Right.
But between the surgeons, the pulmonary docs, and then the general surgeons in our general tumor board, it's phenomenal.
Yeah.
And as an active discussion, and the focus is truly on what is best for the patient. How are we going to get the best outcome, and what is the best thing to do for this
You
particular
don't have
patient?
one expert, you have a team of experts that are
Right.
on your side.
Exactly, and it's I've been able to rotate and participate in those just to listen in. It's incredible. I want to be, if I ever have cancer, I want to be that patient where I have all of those specialties in one room studying my chart and deciding collectively all of that brain power the absolute best route to serve that person.
Absolutely.
It is absolutely humbling, amazing what you guys do.
Exactly.
you.
When we
Thank
said
you.
we will fight, we
We will win. You got that team. You
Well,
will win.
I would also add that if you're a patient with cancer, or you have a family member who's a cancer patient, ask them to ask their doc to present your case at a tumor board.
That's
And
a
I mean,
good idea.
let's call them on it, you know?
Right.
Might as well.
Love
And
it.
Yeah.
Also, speaking of cancer, we have a blood shortage going on right now.
Right.
Tell us a little bit about the importance of why everyone should be donating blood who can donate blood.
Well, first let me say that I'm going to donate blood next week, and
Yes.
cancer patients and cancer physicians are heavy users of blood. Think about it. Chemotherapy drops your blood count. Radiation therapy drops your blood count. In my case, in gynecologic cancers, many women come in bleeding, and they've been bleeding for sometimes months, and they come in. I had a patient come in a few weeks ago with a hemoglobin of 4. That's a blood count of 4. It should be above 12. I don't know how she was walking and
Right.
breathing. But so significant blood shortage, and typically the blood banks store blood, and then they deliver it to us, and we deliver it to the patient. And typically the blood banks sort of go into a decline during the summer months because people are traveling, they're at the beach, they're not so much focused on donating. But we got hit by the coronavirus, which kept people in their homes and away from donation centers. So we went into the summer at a low volume, and we are at a critically low volume. And what I would like to ask of every single person out there who knows someone with cancer, do it for them. I mean, certainly make the casserole. Everybody loves a casserole. My wife loves making them and bringing them to friends who have cancer.
But blood is better.
Blood is better. Blood will save a life. I mean, if you want to save lives, give blood. I can't do what I do.
Sarah gave blood yesterday.
There you go.
How do you, Sarah?
Thank you.
Thank you. I can't do what I do without blood.
Absolutely.
I had a patient that I operated on with the Da Vinci Wednesday, and her blood count was low going into it. It was very low.
Very critical.
And they put her to sleep, and her heart rate starts going up, her blood pressure goes down. There's only one way to manage that, and that's with blood. So we desperately need it.
And we had one yesterday and today, thanks to our partners at the Blood Center. They're out of New Orleans, and they're actually going to be able to, I think started on Tuesday, when you give blood, they will test it for the COVID-19 antibodies, and you will get your results, I think, within 48 hours.
So that's a
they can
free
help you out
COVID
with that.
test.
Yes, so it's
basically.
2 for 1. You help our patients, and you also can get some results back on yourself about COVID.
So you can find out about that by following Sarah's Facebook page.
Yep.
Go to our Facebook page, and the information will be on there
Yes,
about
go
the
to our
blood
events
drives.
on our Facebook page. We don't have any posted right now, but we'll be adding some over the weekend because this crisis is real.
Watch that page. Stay tuned. Again, giving blood. Thank you, Dr.
You're
Finan,
welcome.
for all you do for us. And if you want to help in this crisis, the best thing you can do is to give blood. Watch out for that page, and that's how you can help us stay Singing River strong.